In other health news tonight, are you feeling a little under the weather? You're not alone. NBC 15's Barkley Pollock has more.
Temps outside may be on the decline, but things inside local ERs are just starting to heat up.
Yeah, I would say over the past week, we've really seen a huge influx of patients with those symptoms.
Dr. Brian Mamerow says almost every year at about this time, the number of patients coming to the ER with what doctors believe to be either a gastrointestinal virus like the norovirus or a respiratory virus like the rhinovirus goes up. When it comes to respiratory illness, Dr. Mamerow says you can expect to have a cough and maybe a runny nose, but the symptoms of a gastrointestinal virus are much different.
Vomiting, diarrhea, fevers, some abdominal pain.
We asked doctors if we'd be able to speak to a patient who they believed had something like the norovirus, but they said because of how contagious it is, that probably wouldn't be the best idea.
The respiratory viruses, a lot of them are spread airborne. In terms of the gastrointestinal illnesses, those are usually transmitted more often than not by touching something that's contaminated.
Dr. Mamerow says once you're sick, the only thing you can really do is wait and ride it out. On a positive note, if you contract a gastrointestinal virus, the incubation period is relatively short.
The good thing about them is that usually anywhere from 12 to 12 hours to anywhere to the 3 to 4 day range, they're gone.
In Madison, Barkley Pollock, NBC 15 News.
And you've heard it before, but doctors say if you want to avoid getting sick, one of the best pieces of advice they can give you is to remember to wash your hands frequently.